Welcome to the Mother-Daughter-ish podcast. It's your mama's favorite podcast.
And the podcast your daughter always wanted.
This is Miss Dawn.
And Aungelique.
From the 713. Houston, y'all. Get connected and stay connected weekly as new shows debut on Sunday, Wednesday, and please check out our Saturday Out and About showcases.
Enjoy the show. Please subscribe, like, share, comment, and tell every woman on the planet that you know about our show.
Here's our show for today. Hey, it's Miss Dawn. You wondering how you can support our show, Mother-Daughter-ish? We have Cash App, we have PayPal, and we do have Vimeo. Support our show so that we can reach out to more women. Our goal is to reach and build a community of 1 million women. Why don't you come on and help us do that? Hello, mothers and daughters. We are back again with our whole body health series, and today we have a very serious subject today, and it is on mental health and emotional well-being. Of course, you know, without your mental health being in the right place, it can lead to a lot of other complications in your entire life. I'm not just talking about your health, but I'm talking about your body as a whole. You could cause harm to your body if your mental health is not in a great place. Now, I've known people that have had mental health issues. I've seen people with mental health issues. We see it played out every day on different shows. I don't watch regular TV, but I do have YouTube, and I see a lot of things that people report on that I'm just shocked. Like in the last, I would say 2 weeks, we've seen a girl kill her girlfriend in front of a child. We've seen frenemies on a trip with a girl that's, Shanquilla. We see her frenemies did what they did to her. I cannot in my right mind think that somebody in their right mind would do something to somebody like that without having some kind of mental issue. My mind won't let me believe that. We've seen a person shoot up kids at a school that are on the football team with them. We've seen so many things in the past few weeks that I've decided that I'm not going to get to this place where nothing shocks me anymore, but that I still want to keep my shock factor within me, only because I don't want these things for me to become normalized. So we see a lot, but then I also think that we need to protect ourselves from seeing so much, which is why I don't watch regular TV, and I haven't watched a nighttime news program or morning time news program in probably 20 years, because I don't want it in my spirit. I don't want it on my mind. I just don't want it really anywhere near me. Simply protecting my own personal mental health. I know a lot of people don't look at it that way, but it's the reason I don't watch scary movies. It's the reason I don't watch murder movie mysteries. It's the reason why I didn't watch Jeffrey Dahmer. It's the reason why I don't watch, those Predator. I don't watch any of those type of things simply because I do not and will not have it in my spirit. A couple of facts that I want to just talk about when it comes to mental health is that according to studies, it says 1 in 5 Americans will experience mental illness annually. 1 in 5. So let's line up all 5 of your friends. Line up 4, you're number 5. And out of the 5 that you have, which one is experiencing it or has experienced it? I'm pretty sure you could come up with. I just asked somebody, I said, if you lined up your top 4 friends and you being number 5, and she said, at least 3 of us, and I said, okay, those numbers, that's a big number. Also, it says that most Americans lack adequate resources to be able to help themselves. Having adequate resources is as simple as you don't have insurance, so you don't have a PCP, because when you go to a doctor, even my just regular medical PCP doctor, the very first day I ever went in there, they had a form that asked questions about your mental health. asked questions about your depression level, asked all of these questions. So if you don't have adequate health care, then you won't get asked that question, because most of your friends are not going to say, hey, have you been feeling down lately? Have you been, experiencing negative thoughts? Have you felt suicidal? Have you tried to do anything to yourself lately? Are you more down in the dumps than you are feeling good? Like, most of your friends are not going to ask you those questions. It's not because they're not your friends, some of them, but it's simply because it feels like an invasion of privacy. And if you're around people who feel like every single thing is private, then you probably won't get much out of them. The next fact that I want to tell you, and I'm not going to fight with you, I'm just going to tell you what the medical professional says. And I noticed that there's a change in the name because I was prepared to lay it all out, because I know that it's LGBTQIA plus, but in this particular article it said LGBTQ plus. So they got rid of the IA and just went to the plus. I can honestly tell you right now, I never knew what the IA stood for. But plus explains everything, because plus means just whatever. Without, and I think this is a fair depiction of folks that are not involved in this. I think this is a fair way for us to be able to remember it. LGBTQ plus, instead of coming up with all of these other letters that none of us don't understand. It's not that we're disrespecting, it's just that we don't live that life and we don't know. Just like there's things in our life that you don't live that you don't know. So it says that LGBTQ plus are more likely to experience it more. We're talking about mental health, emotional, and depression type issues. It says that they're most likely to experience it. And I can understand that, because let's say you never felt the need to come out of the closet. You don't have friends that accept you. Guys don't want to hang around you because they think you're going to turn them. Girls are not hanging around you because they feel like, well, they can't sleep with you, so they don't need to be friends with you. Folks in the public, because they're not involved in it, they make fun of you. People want to kill you. And then you have the T-girls who seem to lately always have an issue with everybody. So those are just a few facts there. Now I want to go through the did you know. So we've got some facts. We've got some did you know. We have some resources. Can't end any program without some resources or some kind of highlight. It just wouldn't be fair. But not only did we have some resources, but I also wanted to talk about some mood boosters where you can help yourself. I'm really, really into the helping yourself. So if you're going to continue to listen to this show, you got to know that I've got some resources for you to help yourself. Because when all else fails and nobody else is wanting to help you, you got to figure it out. Number one, I just was wondering if people know how trauma can change your whole brain chemistry. Like, let's say you've been in an abusive relationship. Every time you get with the next person, you're wondering when the shoe is going to drop. Let's say you were abused as a child, then you would think that maybe abuse is just a part of being in a relationship with people. Let's say you saw someone being killed or stabbed or shot in front of you. You just assume, this is just the way it's going to be for the rest of my life. Because see, one thing we forget is how smart our brain is. We can be minding our own business, washing dishes and listening to some good old Beyonce on the ear pods, and all of a sudden something will remind you of something that you're like, oh my gosh, that happened 35 years ago. I'm talking about myself, y'all. Happened to me the other day. I'm in the kitchen, I'm cleaning up, I got my ear pods in, I'm listening to some Beyonce, I'm getting down, I'm cleaning. And then something popped in my head, and I'm like, oh my gosh, I was 16. Like, really? I'm 50 now. Come on. So I do what my friend Louise Dewey told me. She said, when those things pop up in your mind, just say, thank you for sharing, and then you move on. Like, your brain is going to do what it wants to do. Thank it and move on. The next thing I want to know is, did you know that poor mental health aids in negative outlooks on life? So, for example, if you don't have the proper care, then you just feel like it's doomed every day. This is just the way it's going to be. I'm going to feel like this forever. Nobody's going to want to be around me. But then also sometimes people with those kind of negative outlooks, they sabotage their own relationships with other people that are trying to love them. Like, I've known people that will not allow you to love them. And I don't know if it's that thing of I'm not worthy, or it's that thing of I don't know how to love you back, so let's not go there. I have no idea. You can only go so far with that, and then at some point you may have to disconnect from that person, because you cannot allow anybody, of course, to bring you down. The next thing that I want to talk about is, and we talked about this in the last show, about food and water being helpful to you. So eating proper food and water. And here's why I'm bringing this up. I noticed 10, 11, 15 years ago that I can't eat ice cream. Let me tell you why. I noticed, we're not talking about popsicles. We're talking about ice cream, like ice cream. No brand. I don't care who you are. Vegan, whatever. Whenever I eat ice cream, I noticed that I would always feel so sad and down in the dumps. And I'm not talking about the next day. I'm talking about instantly. I would feel down and up. It's kind of like if I eat a pork chop, which I gave up years ago. If I eat a pork chop, I would automatically just want to go to sleep. I would get a headache, and it would just be like, you feel so horrible after. So I was like, it ain't worth it. I'm giving up the pork chops. Did that a long time ago. Haven't looked back up. If I want to know what it tastes like, I go back into my memory. And I remember when I used to fry them so crispy and golden, put it between some bread, and go to town, or with some french fries or whatever. I have all of that stored in my memory, and I can pull on it at any moment. But getting proper food and water can also help with your mental health, because if you eat the wrong things, it could just throw you into a very sad situation. Ice cream did it for me. I can't think of another food or dessert or anything other than ice cream. It's just that as soon as I noticed it, after a few times, I was like, gave it up, never looked back, haven't bought any ice cream in over 10 or 15 years, because I just can't. Um, I cannot. It doesn't work well for my body chemistry for whatever reason. That's why I was asking you, did you know that trauma can change your body chemistry, but so can different foods trigger that trauma and can cause depression. So there are 4 disorders when it comes to mental health. One of them is your mood. For example, if you have like symptoms of bipolar. The other one is anxiety, which is also a disorder, and then psychotic disorder, and then personality disorder. So personality disorder would be, like, for example, if you have 5 or 6 personalities within you, and one does one thing, another one does another thing, and you can have things that trigger. I mean, and I've known people to say food has triggered those certain things. So you have to be really, really careful. The other thing I noticed with my youngest son, when I removed so much sugar out of his diet, his mood got so much better. This happened when he was in high school, and I just was like, okay, I'm not gonna let him, make anything with sugar. We're not gonna bake like we used to. I'm, talking to him about his junk food. And on his own, as he's gotten older, he's figured out how to get rid of certain junk foods, how to incorporate more fruit and vegetable every day. He's done a lot on his own, because even he noticed that the sugar was putting him down in the dumps. And I'm talking about in a bad way. So there are just certain things that our body chemistry will give us a notice of, like, yeah, we're not going to be able to do this much longer. So, enjoy it. So here's what I will say. If you have a food right now that you love, 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 and you're like, I can eat that every other day, enjoy it now, because at some point, it will no longer be your friend. And it won't be because of anything that you did. It will just simply be because your body chemistry has changed, and we have to just be okay with that. Actually, we just have to be okay with that. So, here's a couple of ways. What I wanted to do is just kind of continue to go through my did you know that mental health issues can be caused by childhood trauma, abuse, childhood issues. Back to the part that I said a few minutes ago about how smart our brains are. Our brains are so smart, it will recall whenever and however it wants to. Be ready. And you don't have to do anything to trigger it. It can just pop up. I remember one time I was in the grocery store, and I'm just walking along minding my own business, and I got a thought right then, and it was like, wow, I hadn't thought about that since I was like 17, like 18 years old. The other thing I want to know is, did you know that it can be caused by being solo so much? In other words, being in isolation, not having people to talk to. That's why I remember when I had my first child, Aungelique, I remember she was in the hospital for a little while, and there were other babies in there that you could sign up to volunteer to hold the babies every day. So while she would be sleeping, I would hold the other babies because they needed that human touch. These were kids that were going to go up for adoption, kids that had been left at the hospital, kids that were going to go into the foster care system because their parents gave them up or whatever the case may be. But those babies needed to be held. So I did it for about a month, and it was very rewarding, I must say. It was very, very, very rewarding. If they still have that program, I would suggest if you want to hold babies and rock babies, it would be so. If you have a hospital close to you that delivers babies, that would be a really great thing to do. And sometimes it's not just because the baby's got left or whatever going to foster care. It could be because the parent is ill, or maybe the parent, died in childbirth, or whatever. Mom could be in surgery. It doesn't matter what the reason is, really. Did you know that mental health issues could be caused by poverty and social disadvantages? I found that one to be intriguing for so many reasons, especially us coming out of a pandemic and people's situations have changed. Folks have lost their jobs who had high up jobs and those who didn't. I look at what's happening over at Twitter right now with all the people being laid off and having their jobs. And that's why I say no matter who you work with or for or yourself, always save you some rainy day money. It's not about having a poverty mindset. It's about knowing that these things can happen. So imagine with all these people at Twitter being laid off, they were in pretty comfortable positions doing what it is that they love to do for years. A lot of them are tech people. And we know that a lot of tech people are kind of isolated simply because they're so into their computers. I actually feel bad for them, but I also know that when people come in and they own a new business, the truth of it is that they have to do what they have to do for their bottom line, and that's really what it's all about, and we all know it, but won't admit it. Did you know that mental health issues could also be caused by loss of loved ones? I know this for a fact, um, that this could be an issue. I know my godmother died when I was about 17 or 18 years old, and that was a shock for me. But then also I remember when I was in 10th grade, we had a student by the name of Lenedra, and she died of an enlarged heart. And I don't think they told us the truth as to how she really died or whatever. It wasn't our business, I guess. But that was shocking to see a student die because I was still in that young phase of children don't die type of thing. I had never seen a child die. I never been to a child's funeral. I don't know anybody in my family who had a child that died that I knew about. We were protected from knowing those type of things. So to see that girl die, and I still have her program in my yearbook because she was supposed to graduate with us. But that was shocking to me for a student at the school to die. And at that time, I have to say, schools did not have the resources to even help you to understand what the heck was going on. So it's just kind of like they told us, they said a thing on the speaker thing, and that was it. We all went to her funeral and everything, but still, that was it. It was no grief counselors or none of that stuff, and that was unfortunate. Did you know that stress, especially long-term stress, can cause mental health issues? That vicious cycle of stress, not only does it cause mental health issues, but it causes nervous breakdowns because stress gets into your body on a cellular level. And on that cellular level, that gets into and seeps into your skin, your mind, your body, your soul, every piece and every inch of you. But then finally, did you know that mental health disorders, and I know you know this, that it's also hereditary, it's biological, and it's caused by your environment. Meaning, hereditary, somebody in the family; biological, your chemistry from your mom and dad's chemistry, and those sides of the family. But then also your environment, meaning the type of environment you grew up in, what type of people what's the comedian say? Who raised you? So that matter. Who raised you matters. And I want to say to every parent out there, there can also be a case where it does not matter how you raise your children. they're going to do what they want to do. One of the lines that I'll give you that will have multiple resources, including the suicide prevention hotline and the disorder hotline, I would say get connected to your 211. I was never so excited than when I was in Canada in 2007. I've been since then, but when I was there in 2007, I was riding on the train to get to a particular destination, and they had 211 on a wall there. And I thought, oh, wow, they not only have 211 in the U.S., but they have it in Canada, too. I thought that was so cool. So I called the number, and they actually answered, and I was like, I did not know it was a global thing. I thought it was a Texas thing, or at the least a United States of America thing. I didn't know that it was a global thing. I was so excited to see that, because at that time 211 was the end all be all. I don't know how 211 is now, because every time I've called to help somebody with getting some resources we've had to hold for so long, we get people on the phone that are not knowledgeable. And so I think that was only because of the pandemic, and I'm hoping that they've gotten better with 211. But no matter where you live, 211 is available. And once you talk to them about your issue, you can also apply for your insurance there, any kind of benefits that you want, and also get help for mental health issues. Now, a couple of other resources other than 211 that I do know about is making sure that when you do get your primary care physician, that's what the PCP stands for, make sure that you take that evaluation that they give you. There are sometimes when doctors give me certain papers, I won't answer certain questions, because I'm just like, I hate to say this, but some doctors are so dumb that they'll go and read in a book, and then they'll come back and tell you what the book said. Just give me the book and let me read my health issue or whatever. But don't try to say, oh, well, if Auntie so-and-so had this, then that must be your problem. It could or could not be. Still, I want you to evaluate me as a individual human being. Okay? So stop asking me about what everybody and their mama had in my family, and just only evaluate me as a human being, and then we'll get to the bottom of what the issue is. But quit trying to call it in and phone it in. That's just my personal thought. But then also another resource could be making sure that you're getting your meditation and journaling in. And if you read back through those journals, it'll tell you what mind state you're in. Like when I go through my gratitude journals and everything, oh God, I get so excited. I'll be like, it's kind of like looking at my bucket list, where I see so many hurdles that I've crossed, so many wonderful things that have been materialized. I mean, just even today, I can't tell you what. I'll tell you later, maybe in 2023. But something very, very exciting happened to me today. And it wasn't something that shocked me. It's something that I've been saying every day, that the universe is conspiring to make this happen. And something very amazing happened today that I cannot talk about today, because today is not the time. You know, there's a time and there's a place. This is not the time or the place, but I do want you to know something exciting happened for me today. And I'm just kind of sitting back going, okay, all right. You know, that's what I have to do for myself. I go, okay, all right, I got you. The other thing that I wanted to tell you as far as a resource would be making sure that you stay connected with other people. There are so many groups for everything, okay? And you can pay attention to your health yourself. There's a group for everything. I want you to take this from someone who built their entire business on networking. My entire business was built on networking. Do the same for your mental health. Find out what groups meet. I don't care if you have to get on meetup.com. I don't care if you have to get on Eventbrite and find out who's getting together. I don't care if you have to join your church ministry groups for mental health. Get connected. Stay connected. And be remembered. I used to say this all the time. And it's not that I've stopped saying it. It's just that I'm in a different way of how I network. My migration into networking went from face-to-face every day, all day long, to face-to-face and Zoom, to face-to-face Zoom and connecting on social media, to now maintaining what I have. I find it to be of no need to network every single day. I do still have 3 groups for business, for the podcast, that I do associate myself with. Women in media, black women in media, and these are the ones I pay for, by the way. I'm in a ton of other networking groups online that, they're just groups that associate online. They don't get together or have conferences or anything. But then I'm also in American Advertising Federation here in Houston. So network how you want, but I'm telling you, coming from my mouth, I'm telling you that networking is what built all of my businesses. So imagine if you took your mental health that serious and you found out about every group you could get with. Look at alcoholics. They have AA to get with. Alcoholic Anonymous. They get with that group and they meet so many people that they have to talk about their issue. See, think about it like this. When you network in business, you now have other business people to talk to. Whereas if when you're trying to talk to your friends who either work a 9 to 5 or just don't care, they're not going to give you any feedback. They don't have anything positive to say. They can't share anything because they're not on that level. They don't know. Think about your mental health. If you were to join different groups that you could talk to these things with, you would realize a few things. First, you're going to realize you're not the only one. The second thing you're going to realize is, oh my gosh, I have somebody who understands me. The third thing you're going to realize is, wait a minute, I'm worthy of staying around and staying alive because I have something in me that I'm supposed to put out into the world. The other thing you're going to realize is that there are more resources than you thought, because for every association you can partner with, and a lot of these places do not cost unless there's food involved and they tell you to bring something or whatever. But there are ministries within churches, there are ministries within hospitals, and when I call them ministries, I'm just saying these are groups that you can get with to minister your mind. You probably could talk to a few friends about it, but if they're not going through it, they're not going to be able to relate to you or understand what you're exactly talking about. And it's nothing like wanting to express yourself, but you don't have a way to express yourself to people who are going to understand you. And it's not because they don't always care. Sometimes they just don't know what you're talking about. Like in business, I would meet people not at networking events, but outside of networking events. Let's just say at the grocery store, whatever, and they would ask about certain things. I would talk about certain things. But then when I got too deep, they would give me the blank stare like, lady, listen, I don't know what you're talking about. It would kind of be like that. And so when I start getting that deer in the headlight stare, I just shut up and like, okay, let me shut up and let me save it for the next networking group. But that's what built my business, was networking. If you want to build up your mental health strength, get connected. Get connected with groups. If you have insurance, make a phone call to your insurance company and say, hey, I'm experiencing this, this, and this. Get you an evaluation and find out where your people are. Find out where the group is. Find out if you're a person who you don't believe in medication. That's something that I thought was so interesting that my doctor said. She said that she had to ask one of her clients if he even believed in medicine. Because, everything is about our belief system. If we believe in something, I'm trying to tell you, miracles will happen. If we don't believe in it, then you get what you're going to get. But she said she asked her client, do you even believe in medicine? She never had to ask me that because I gave her my point when I met her. I told her what I felt about everything when I met her. She says I'm a very difficult client. But at least she knows where I stand. At least she knows what I believe, what I believe in and all of that. So there's no secret. She and I don't have any secret. She knows where my mindset is. But getting connected, I think, is going to be a very good resource. Again, when you dial 211, you can absolutely ask them on the phone, hey, here's what I'm experiencing. Are there any resources for this? That is what 211 is there for. That is what their job is there for. That is the whole reason they set this thing up, so you can get help with benefits, you can get help with resources, you can get help with referrals, you can get help with applying for insurance, you can get help with all the things that you need. So take care of your mental health and you will be taken care of. And there's a lot that goes to that, because you have the discussion, you have the admitting it, you have the connecting with others, you have possibly the medication, you have possibly considering what you can do naturally to help with your mental health with herbals and essential oils and things like that. You have the choice of getting under a physician's care. You have the choice of connecting with others so that you have healthy conversations around this. You have the choice of whatever it is that you feel like is best for your life. You have the choice. So you cannot ever say there were no choices and no resources. It's which one did you choose or did not choose. That's my show today, mothers and daughters, on mental health and emotional well-being, getting your resources and recognizing those things. Like, imagine if there's somebody whose family member, or let's just say some woman out there whose husband has just died. That was your rock, that was your provider, that was your lover, that was your children's father, that was the person who's been taking care of you for however many years. And now all of a sudden that's been removed from you. Then you start to wonder, what am I supposed to do? What am I worthy of at this point? Maybe you're older and you don't have an education good enough to go and get a job because you've been taken care of for 20 years. You have to now figure out how you're going to move forward with your new life, meaning you got to put new things in place, meaning you got to think new thoughts, meaning you got to surround yourself with different people. It's a whole plan, okay? And I don't want to go through every single thing, but I'm just saying, if you've experienced this, get with other people. In that scenario, I would say talk to other widows, talk to other women to see how they got out of their funk. Or if they haven't gotten out of their funk, maybe you guys should put your own networking group together where y'all can talk about what it is that you need to do to get back on a right path. A right path of thinking the right way, a right path of journaling, a right path of making sure you're nourishing yourself, a right path of making sure you're having these conversations, a right path of talking with your physicians about this, a right path of whatever right path means to you, because it's your life. You get to decide, and that's all I have to say about it. So that was my talk today on mental health. Make sure you're subscribed. Make sure you have the notification bell on when we put up new shows. I have so many topics and so much information. Let me tell y'all something. If y'all have children that are in grade school that talk a whole lot and get in trouble about it, don't be so hard on them. Don't fuss at them. Try to keep them calm. Give them time to talk as much as they want till they get on your nerves. Just hear what they have to say, because later on in life, it will all make sense. Like, I can talk you under the table. You know how some people say I can drink you under the table? Well, I don't drink, but I talk. I can talk you under the table with no remorse, barely breathing. Now some people, I can just talk and talk. I've always been this way. As a matter of fact, I dated somebody one time, and he said, "You know what I want you to teach me?" And because I'm like this, if I can't learn from you and you can't learn from me, there's no point here if we're not learning from each other. He said, "You know what I want you to teach me?" I said, "What?" He said, "I want you to teach me how to communicate. Like, you talk a lot and I don't like to talk. So I'm going to need you to teach me that so we can communicate better." And that's the way it was. But I appreciated that person saying, basically, you talk too much, and if I'm going to hang with you, I'm going to have to learn how to talk more. But they said it a little bit nicer. They just said, I lack in this area. Can you teach me how to be that assertive and talk like that? Not like that, but talk. Like, I can meet a stranger, and we'll end up having something in common. I can meet people in business that they do something totally different than I do, and we'll have something in common that we can talk about. We can talk about travel. We can talk about business. We can talk about kids. We can talk about life. We could talk about lessons. We could talk about books. There's a lot we could talk about. But that's my show for today. Thank you so much for listening. Thank you for paying attention to our health, mind, body, soul, full body health series for the month of November. I can barely contain my excitement for December to talk about all my travel excitement and things I've learned, people I've met, lessons I've learned, people I've traveled with that I'll never travel with again, people I want to travel with, places I want to go. I just cannot wait to speak with you about it. I cannot wait to show you pictures. This weekend, I spent the whole weekend, about Saturday and Sunday, 8 hours a day, digging up old pictures, cruise pictures, video, all kinds of things. Back then we had actual photos, so these will be transposed photos. But that's my show for today, and until next time, bye.
Hey, it's Miss Dawn. You wondering how you can support our show, Mother-Daughter-ish? We have Cash App, we have PayPal, and we do have Vimeo. Support our show so that we can reach out to more women. Our goal is to reach and build a community of 1 million women. Why don't you come on and help us do that?